What I like to do, what I like to do is we like to put topical local anesthesia on the skin. That kind of numbs the skin, and we incorporate that with the smallest needles you can use almost to put the Botox in, because again, we like to be as painless as possible. Now, this young lady also has headaches, and I'm doing the Botox both for the cosmetic reasons and to cut back the incidence of her headache or intensity of the headaches. So I'm going to start by putting some Botox into her forehead. And when I do the Botox, I try not to touch the periosteum of the bone, which is very sensitive. I judge how thick her muscles are, and I go right into the muscle, and that's as far as I go. And again, I like to emphasize she's not squinting or making faces that I'm hurting her, which is what we're trying not to do. So I got that part. Then when it comes to the center, we put the Botox in the procerus muscle right there. Then we just put a little ice on. See, she's smiling, and we're all done. And that's Botox injections at the Laser and Cosmetic Center, Los Gatos, California. I just put a little bit of ice on afterwards, and in a couple of days all the wrinkles will be gone, and hopefully the headaches will start to diminish again. Some people get kind of an ice headache from the ice, so I tell patients to put the ice on and off. You don't have to keep it on for the whole time. Now I'm adding to her Botox a brow lift. By blocking the muscle on the lateral aspect of the eyebrow, I'm trying to arch her eyebrows up, using the muscles of the forehead to lift her eyebrow. That should work out very well. And as I said, we use very small needles. We try to be as painless as we can. And the doctor in our place is the only one who does Botox. Nurses can do it too, but in our facility, only our physician does the Botox. Again, working on the brow lift. Just a little bit of Botox. And you see around the eye, I just make a skin wheel. The muscles around the eye are actually connected to the skin, so there's no reason to go in deep and cause a bruise. So there it is. A brow lift and Botox. And we're done. I'm going to add a little bit more. And then the muscles right under the eye sometimes cause creases. So I put a drop of Botox there. You can't use much and you have to be careful, but it works out very, very well. Again, just to have her look up towards her forehead, and I just put a very small amount of Botox right underneath the eye. So we'll get rid of all those wrinkles, and it will open her eyes up for the wow effect. That's what you want from Botox.